Okay, today I'm doing HST, and the problem I'm having with this report is I'm not getting it between 4 and 6 minutes. It's very important to medical humanities due to having empathy for your patients and being aware that people are going through things that you might not be aware of, and don't be quick to judge. And the knowledge of our medical staff is not very high. So I had 3 articles. The first one is based on what nursing staff and people who work with HST patients don't catch, and they don't know that they're HST patients. The second article is about the law and the medical staff, how they treat the HST patients. And the third article is about clinics that help HST patients. So the first one tells you the problems with HST and why it's in the US is because of drugs. And they also have false advertisements. 18,000 people are trafficked a year. They're mostly women. Some of them are men. The age starts at 12 and it goes all the way into their 30s. Then it tells you that the nurses are not trained on red flags, and there is a group of people that help train them, and that's the Blue Campaign. And then Polaris is a hotline that you can call and report if you think someone's been human sex trafficked. So if you want to spread the word, you can. And then they did a study on mainline health people who were trained to catch red flags, and the nurses and staff who were trained said that they felt more confident after being trained. And it mentioned that 1% of the United States national hospitals, 1% of the national hospitals know about HST, so that's 6 out of 6,000 hospitals, which is not many. And they mentioned that 40% of the victims went into the healthcare provider's office, and they thought there was something else the nurse or staff could have done to help them, but they didn't because they don't know. And then it was kind of interesting. They said that the traffickers took 87% of the victims into healthcare providers, to healthcare providers to help them with their health issues, and then 63% was taken to the emergency department, but they still were not catching these cases and reporting them. And the second article, it tells you about how the victims feel in the U.S. that are human sex trafficked. So our cops are criminalizing and stigmatizing them by saying they're prostituting, but they're turning around and sleeping with them. So if they're brought here from another country and they're foreign, they don't understand their rights and they're getting taken advantage of. And I don't think very many young people know their rights, especially if they don't even know what day or time it is, their name, and they have broken bones and many health problems. Yeah, that's an issue. And then it was telling you that the front healthcare line people that took care of the victims made them feel, I guess, worse about themselves because they were being judged by the healthcare provider, which is not right. And so I think our medical staff really needs to be trained to learn how to treat people, even if they're busy and they're slammed with a bunch of people, and they definitely need to know the red flags of certain tattoos that they have, STIs at a young age, multiple abortions. Our funding for the U.S. is $130 million for non-U.S. born HST patients, and for U.S. born HST patients it is $30 million. So I don't know if I guess maybe there's more out of the United States human sex trafficked women and men, but either way it's kind of strange. It should be about even. And our medical staff definitely needs to know. And so finally, with all that bad news, I researched a third article, and it gave 5 clinics that got funding and grants, and the doctors did the work for free for the patients, and they had all sorts of doctors in there, doctors from like eye doctors, attorneys, psychiatrists, a 8-week program, and their OBGYNs, other kinds of doctors, and the goal was overall healthy living. I did not know, I didn't get any research about what happened to the women after they went through the programs, if they went back to human sex trafficking or they felt better. And for the people who are trafficked in the US, I did learn that they're abused as children. So I think it's a big problem, maybe in low SES or even high SES. I didn't get too much information based on that, but I thought it was a really interesting topic, and it's something that the medical staff needs to be aware of, and it ties in with medical humanities because you need empathy for all these patients for sure. I enjoyed learning about it, and I read the articles, and they were enjoyable as well. And that's all I have.